Today we are starting something a little bit different where I'm taking a classic podcast and I'm rebroadcasting. And right now, I would just want to give you a little clip of an episode that was previously broadcast way back when I first started my podcast in early 2019 with Kelsey General, who's a single mom of two boys on the spectrum, and she's living in Canada. So I'm just going to present this older clip. And then next week, we're going to do a little clip with an update from Kelsey on her boys, her life, and her work within our online course and community. So let's watch this little clip to go way back in time when Kelsey's boys were 4 and 3. Hi, I'm your host, Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author. Each week, I bring you a video. So if you haven't subscribed to my YouTube channel, you can do that now. This week, I am presenting a short clip from a very old podcast, one of my first original broadcasts with Kelsey General, who is telling us about her life and her boys starting to show delays, getting diagnosed, and how she weaved through the maze, the autism maze, and where she was at when her children were 4 and 3.
It took until he was 25 months, and this was when he was 18 months that we got the referral.
Okay, so just under a year.
Yeah.
So, and during that year, you were doing what?
Well, during that time, I was dealing with, I wasn't doing that much with him. I mean, I was staying home, trying to live a normal life, trying to read these books and do as much as I could, but I really didn't know. I was in a high stress situation at home. Things were getting worse and worse there. And so while we were waiting for the evaluation, I actually left my ex and became a single mom and moved in with my behavior analyst friend.
Oh, wow.
And for a few, and and started kind of planning the next stages, but I knew I wasn't going to leave Alaska until he had his evaluation. So all the court dates happened. I got full custody of my kids and planned to leave the country, but we waited until diagnosis day, and then we basically left the next day after he was diagnosed and moved back to Canada.
Okay, because you're a Canadian citizen.
Yes.
So your life was basically on hold, waiting for that diagnosis day.
Yes, and I wasn't doing much at that time because at that time, I mean, my behavior analyst friend ethically couldn't support, any therapy with Brentley other than giving me some resources. And I was just under the impression that I just needed to wait to get that diagnosis so that he could get 40 hours of ABA. I just thought that was when my hands were washed clean of anything. Which is funny now, but I thought, oh, that's the end. Once I have the diagnosis, it's done. It's fine. That's all I need to do. That was my, most people say that they're upset on diagnosis day. I was relieved. I was like, okay, now we have this diagnosis. We can go get ABA. We can go back to Canada. Court's done. I was thinking it was good.
Okay, so you moved back to Canada, and then ABA miraculously started, right?
I wish. That would be nice. No, in Canada, the system's very different. Every province is different, but in British Columbia, children who are under 6 get $22,000 a year for the parents to basically do whatever they want with under some guidelines. But you can't access that funding until you're a British Columbia resident for 3 months. So during that time, I still, we were adjusting to new life here. He did regress again. He basically started just screaming as his form of communication. And he stopped eating a lot of foods. He was already pretty restrictive in his eating, but it got worse when we moved to Canada. There was lots of different brands. I couldn't get Jimmy Dean's sausage, which at that point was what he really enjoyed. You can't get that in Canada. So we just waited. I had to pay for a private psychologist to confirm his diagnosis so that we would qualify for funding. But once all that wait was over, we signed our funding agreement. We got the $22,000, and
then ABA miraculously started, right?
No, well, I guess it kind of did. Yes, I found, but it was not 40 hours. So $22,000 does not go very far, if anyone's wondering. It qualified him for about 6 to 8 hours a week of therapy. Yeah. And there was no behavior analysts in my area. There were a couple programs saying they were autism programs and, that they were helping these children. But I knew from my history that I needed a board certified behavior analyst. That was really important to me. And so I found one about an hour away. We met. I interviewed her the best at that time I knew how. Seemed okay. And then I started driving him an hour each way, 3 or 4 times a week to this. It was a room in a community center, and it was a type of preschool program where each child had a one-to-one.
Okay. So how old was he at this time?
Just under 2.5.
Okay. And then you also had Lincoln, your baby. They're 18 months apart?
They're 18 months apart. So he wasn't even 1 yet. He was just about 1.
Okay. So when you started driving him to the clinic at 2.5, after you've been concerned, you were concerned at 6 months, then you were really concerned after a year. Now you're 2.5. He's 2.5. You're driving an hour each way, not for 40 hours of treatment, for 8 hours of treatment at best a week, plus the hour each way commute and your baby.
Yeah.
And can you describe Brentley's behaviors at that point?
Yeah, at this point, things had gotten pretty bad. He essentially had a lot of tantrums. Anytime he heard no, anytime a routine was different, anytime he didn't get his way, or, we had to clean something up, he would flop to the ground, throw himself back, and slam his head on hard surfaces. And he hit it hard.
How many times a day would he hit his head?
Up to 100 times a day, sometimes more. It would depend on the day and the kind of stressors that were happening for him. He still wasn't communicating very much. So
he had some words at that point?
He had some labels. Did you know how to teach to communicate?
Did you know how to teach him language at that point? Teach him new words?
No.
And did you?
I was trying to find ways, but no.
And because you were a single mom at this point, you had your baby, you had him, and you like to go hiking and go out in the community. So can you describe what that was like right when you started ABA treatment?
Yeah, so that was scary. It was hard to take both out. Brentley would need to have a backpack on with a leash because he wouldn't hold my hand. He would often bolt away. Once when we got to therapy, actually, he decided he didn't want to go, and I didn't have him on the harness because it was like a 10-foot walk into the building, and he ran 3 streets over.
Wow.
He was gone, and I could see him a lot of the time, but he was, I didn't really expect that to happen. And outdoor activities, I would normally either wear him in the pack on my back and Lincoln on my front, or I would have him in the harness. But even that sometimes didn't work. He would flop to the ground, like we would call it the wet noodle. And we couldn't even walk into a store from the parking lot. Luckily, in Alaska, they gave me a handicap sticker so that we could be closer to the doors. because Brentley's not a small guy. He never has been. And so trying to manage dead weight of an over 40-pound kid at this point was very difficult.
Okay, so the ABA clinic that you were driving to, that did have a board certified behavior analyst there. Were you seeing a lot of nice gains with that, or how was that working?
No, there was not very many gains with that. So his first assessment they did the ABLES assessment, which is a type of verbal behavior assessment. He had about one box filled, I think. Maybe not even that. I mean, he didn't respond to people. He didn't respond to anything. And then they began teaching him colors, and we're trying to teach him through play and building and having him engage with different toys, which actually Brentley's always been very good at. He's good at engaging with objects in his own way. So it was really just allowing him, it was really almost just like babysitting, and, trying to teach him skills that were pretty beyond him. I mean, I'm not sure why you would teach a child who can't even request what he wants colors.
Right. So, and he was still having the major problem behaviors. They were even coming to your home a little bit, but they weren't really helping you to solve the immediate safety issue of you even going to the grocery store without major safety issues.
No, they, and the behavior analyst came once and watched me at the store with him, and, but really, again, no strategies that were helping or that were working. It was just difficult to watch, and it was frustrating to watch, because they didn't really want me that involved either. And it was like, well, I'm the one who's with them all the time. I need to know, what's happening.
I hope you enjoyed that short snippet from podcast 175, which is our first classic podcast reboot. If you did, I would love it if you would leave me a comment, give a thumbs up, or share it with somebody else who might benefit. And for more information about joining our online course and community, you can attend a free workshop at marybarbera.com/workshop. And I'll see you right here next week.